legal name, those are not available for me to see. And that's been one of our big holdups.
Right.
So I have great concern about information about individuals getting out there. But also we want to be able to reach out. So finding that fine line is very important. There are several laws, the interpretation of them becomes difficult, and different jurisdictions are interpreting them differently with regard to this particular population. So it's,
Yeah, would you please provide a code? I mean, I like to read about it, it's interesting. So if
we
you
can provide you those. There are a number of overlapping ones.
Mhm.
This would be mostly
Yes, yes. I'm very familiar with HIPAA from my work, so. Thank you.
Any other questions for Dr. Reedy? Okay, we'll move on to Charlie with Cox Holiday Young in the financials update.
Good morning, everyone. You should have received the January final financial statements and February preliminary. So to do a quick overview on the January statements, not much change from last month. Total income for July through January of 2022, income is $545,000. Salaries and wages, you spent $643,000, and total expenses $135,000. So as of end of January, you had a net loss of $234,000. Your total income is slightly behind budget. That is not surprising. If you look at historical data, the winter months are hard on your income line items. Salaries and wages were up a little higher because of their retention pay, or incentive pay, sorry, that you will get reimbursed for, and your operating expenses are below budget, almost 5%.
And that was it $5,000 per employee?
It was about $62,000 total.
62, and we have
11 people received it.
and revenues of this.
Well, between 5 and 6.
Yeah, minus tax, of course.
We have 72.
Under receiver.
Any questions for Charlie?
Yep, I have a question.
Yes, absolutely.
In the transaction accounts,
Yes.
what's limited, debits and credits.
Mhm.
A credit would be,
When money's going out.
and debit is money coming in.
Correct.
Big difference between January and February.
Yes.
What would account for that?
So you, so in February, your revenue did increase, but you haven't necessarily received payment for it yet.
Mhm.
So you should be getting that money hopefully in February.
Okay.
So it's just the timing of when you invoice and when you're receiving the payment.
Yeah, and an accounting ease, when debit is usually, you're thinking.
Yeah, when you go
it's
to your bank
reversing,
account,
right,
it's reversed, yes.
Okay.
So to that point, as of January, your cash account was at $453,000. As of February, the cash is at $392,000.
That's a pretty significant drawdown.
Yes.
So
And-
Charlie,
and-
go ahead.
sorry.
No,
Oh,
so
I-
do you see it impending cash flow issue in the next couple of months? It seems like the out and the speed at which it comes in, certainly, I mean, quick math, 3 or 4 months could cause an issue if this continues.
Right. Right now, I do not foresee that. March, usually your permit fees grow, and we haven't seen much income in that line item last couple of months. But you also have grants coming in. So I do not foresee it being an issue.
Does Cox Holiday have any suggestions on how to improve cash flow? Because the money goes out at a steady pace, but it comes in at an erratic pace.
Yeah, so you do have your income is cyclical. You're keeping your operating expenses low. As of February, your total operating expenses are almost 10% below budget. Your biggest line items are your salaries.
So, to your point, we have 148,000 in accounts receivable.
Mhm.
So, at what rate do you anticipate that money coming in?
I would have to review it. Though I will say, I believe there is a double entry in there. So right now, and I was getting ready to get into this in February, threat preparedness, it looked like it was accidentally invoiced twice when it only should have been invoiced once. So it should be $27,000 instead of 54 that you're seeing, and that's gonna be in the accounts receivable.
So we should mentally subtract about 27,000.
Correct.
So it's really, we're looking at 121,000. What is that made up of?
I
Besides-
would have to look, I know this might, a lot of it's gonna be, your insurance invoicing and all that. And that also just depends on, and where you're getting money from.
So
Did we
I-
receive the money for the grant that we used for the salaries?
Not yet.
That's
So-
been billed and it's
That's
been
part of
invoiced and it's
That is a
been
big part of
approved.
it. That is
That's,
$61,000.
yeah, that 61,000 of that money was paid in those salary things that's billed to a grant that hasn't been paid yet.
Yeah, so my concern is just simply cash flow.
Absolutely.
And there's this, to me, in my opinion, there's a cash flow issue. So the question I would have is our payables, how quickly do we pay those?
You're,
Are on 30-day terms?
yeah, you usually don't have much in payables.
Okay,
I don't have a balance sheet in front of me right
but
now.
most of it's salary and then payables. So
Mhm.
salaries, bi-weekly.
Correct.
And payables are
I think within
monthly.
30 days.
monthly. Okay, and then when we send out invoices for grants and things like that, what's the?
Sometimes they're quarterly.
They're
Yeah,
quarterly.
so the threat preparedness that's in there right now, that's quarterly.
So conceivably, if we continue to be in cash flow problem, we could push our payables out to 45 days or something, or relieve that problem. Okay.
But I
Don't
think
that's
we're at the
necessary.
scariest part of the year.
Agreed.
And I think we're gonna see the income grow the next couple months. And once we get that $61,000 back from the retention
DHHR.
incentive,
Yeah, it's DHHR.
yes.
That is intensive. Why don't we pay ahead of time?
Because that's the way grants work. Very few grants actually come and hit the bottom line before you begin to invoice them and bill them. You bill them and they reimburse you.
But
So
you
do we
can
have-
definitely wait to pay our employees, right?
We can't wait to pay our employees.
To the incentive,
Of the incentive,
that's one thing.
regardless of when that was paid, we wouldn't be paid prior to it being paid. Regardless.
You have to pay it first.
You have to
before
pay
you
it
get
first, then you have to invoice it, and then you'll be reimbursed.
Okay.
So I think the bigger question is to figure out, is probably to determine how much money has to be in savings to cover the cash flow difference at all times.
Mhm.
Yep.
And I can do a
Correct.
calculation for
If
you.
you could do that calculation, beneficial to the board, because if our savings gets too low, then we're going to hit a critical point where we're not going to be able to pay staff.
Absolutely,
And
yeah. and we don't wanna get to
we're
that
heading
point.
that direction.
There is a motion from several years ago that establishes what the base of that is. too.
Oh, okay, I'll
Oh,
go
it
back
is.
and find that, thank you.
Well, but that has to be recalculated based on the new payroll budget.
No, it was set,
Is
So
there
that
a
it would-
formula?
there is a number set so that would address those issues.
I see what you're saying.
But
Okay.
is it a formula which, because if operating costs go up, that number has to go up. If operating costs go down, that number.
I think you need to go back and look at it, but there is a
Yeah, I'll see
motion
what it
there
says, for
that,
sure.
that established what the floor of that needs to be. And it is some percentage of operating cost and payroll.
For the county, 17%.
On top of my head, it's probably like 300,000, something like that, but don't quote me on that. That's what I believe.
But yeah,
So we're going below it.
but your concern is valid. I mean, your your net loss right now is greater than what you budgeted. So it does look really scary right now, but I think we will see improvement in the next couple of months. Maybe not as much as we'd like to see.
Okay. Or yeah, I'm scared.
Yeah, I understand. Yes. That's understandable. And I'll get back, I will also look into your accounts receivable and see what the timing normally is on that.
Gina, is that something, that motion that Ms. Smith brought up, is that something? that
I'm sure we could.
you could- Okay, thank you.
It's within the last 2 or 3 years. There was a floor set.
That must have been based, that was an intelligent floor.
So just go over February real quick. Again, your cash balance is $392,000 roughly. For the fiscal year to date, as of February 28th, we have total income of roughly $22,000. Salaries and wages, $714,000, and operating expenses at $142,000. Bottom line there is a net loss of $234,000. For the month, just for February, we did see an uptick in income. Income was about $76,000, and that number is a little different than what you're going to see there because I took into account that possible double entry that Marty and I are going to discuss on Monday. Salaries and wages, excluding the retention incentive, is above budget by about 7%. And then your total operating expenses is below budget by 10%. For the month is on $7,000 for operating expenses. Hopefully I went through that in a logical order. For the month, we just had a net loss of $1,200. The previous month was $150 net loss. So
That's calculated on an accrual basis. Right?
correct.
If no other questions for Charlie, is there a motion to accept the January financials?
So moved.
Second.
All those in favor say aye.
Aye.
Opposed? Please have the record reflect that Ann Wynn opposed acceptance of the January financials. Thanks, Charlie. We'll move that on to the COVID-19 activity and vaccinations report with Dr. Rady.
Gonna pull up a PowerPoint. So the board members can see this. So in the
So you shared in Zoom. Excellent.
So in the last 2 months, the number of cases peaked and has come down. You can see since mid-November, there's a pretty large increase, and actually since mid-November, that's kind of the halfway point. Before that day, we had half of the total cases that we've had of COVID in the pandemic in Jefferson County, and since then we've had 50%. Next slide. So this is just looking at October through now. You can see it has come down a great deal. It continues to drop. We now are having about 3 cases a day, sometimes a little more. That gets us almost back to where we were in July, where we were having 0 to 2 cases a day. Next. The CDC has changed the guidance by the prior guidance because we're still having just over 30 cases a week. We would have had to have, by the old guidance, 29 cases or less a week before we would be considered in the medium range. That's all changed. Now we have fewer than 100 cases per 100,000. I think that's the new benchmark. And we have fewer than 10 hospitalizations a week. We are in the low transmission level. The specific guidance is very different than in the past. And that's stay up to date with vaccines and get tested if you have symptoms, and then obviously stay away from people. That's the simplest view of it. On the individual basis, it gets more complicated next. This is a view of community levels by county map. Of course, we are part of the Washington metropolitan area. We're in green, meaning at the low level, but you can see much of Appalachia is, even though the West Virginia map, because they use different metrics for their map on the West Virginia DHHR website, is almost entirely green. By the CDC map, you can see we're higher, the state is higher than much of the country. So if you're traveling throughout the state, you may be in areas that have higher transmission. Next. So our current guidance for this community and most communities in the US are include that anyone may mask, and that's especially important for people who have immune system problems. That can include being over 65, because our immune system, like many other parts of our body, loses some of its abilities as we get older. People with symptoms need to consider that they could have COVID, even though it's not as much as we had before. It's still going around in the community. We're still seeing new cases, and it's probably an undercount because now many people are able to test at home and then don't report that. So there are more people who have who are aware they have COVID and are doing proper actions, but it's just not showing up in our data. If you're immunocompromised, then you really need to get with your practitioner, or people can call us and give them further advice on what to do next. That's the immunosuppressant calls. Next. So this remains almost entirely Omicron, and the different shades of, this is across the US, the different shades of purple are the different variants of Omicron. We don't know that the other variants are any more dangerous. They may be a little more transmissible. Next. The case numbers in the hospitals have decreased a great deal. I don't have the Winchester data on there. But we still have in the Berkeley and Jefferson medical centers, that have cases, and then we have other people who are hospitalized in Maryland or Virginia, and they don't show up on these hospital reports. So it hasn't gone away. People in Jefferson County are often now transferred to Berkeley if they have COVID. Previously, there weren't any beds available anywhere. So, next. Wastewater surveillance is something you may hear about. It's where sewage is sampled to see if, how much COVID is evident in that. So that's one way to try and detect if there's an increase in a community. You can see it's not across the nation, but next. But West Virginia is doing it, and the city of Charlestown's treatment facility is reporting. So the numbers for almost everywhere in West Virginia have dropped off a great deal from what they were a few months ago or 2 months ago. This is a new program. Whether this is going to be an early warning system or not, I'm not sure. It becomes especially important when you're considering that many people with the disease won't be reporting it because they're testing at home or may not be aware. It's something new in public health. Next. So vaccination, this is vaccinations from January. So 60%, 61% of the populations had full vaccination. Over 65, which is the biggest group of importance, if I had to choose one, they're at 90%, which is good. That means they've had 2 doses of either the Moderna or Pfizer. Next.
What's the definition of fully vaccinated?
So fully vaccinated is receiving the primary series of one of the vaccines. For the most part, we're talking about Moderna or Pfizer, which are both 2 doses. If you're an immune suppressed person, it would be 3 doses, but that's a minority. So for the most part, we're talking about 2 doses. If it's a Johnson & Johnson vaccine, it's 1 dose. That's mostly not being administered now. Those who had a booster dose, that's people over 65 who had a booster, was about 60%. That booster dose is very important for helping prevent serious disease. So my biggest target group for immunizations would be those over 65, getting their initial series of vaccines and then getting 5 months later getting their booster dose. Whether a 4th dose for the average person is going to be needed is not yet determined how valuable that will be. I think that's the last slide. In the future, I don't think we need to continue the COVID report. That can just be part of the health officer report on the agenda.
Noted.
Actually, to that point, do we need to, these slides are obviously great and very informative, but is it something that was more appropriate just to be, posted publicly, shared with the board in advance? But does everybody still like receiving sort of the full report from Dr. Reedy? You do? Okay.
Yes, I would.
I'm seeing nodding.
And I have a couple of questions, at least one. Since these vaccines were rushed to market under an emergency use authorization, they weren't tested, because normally you would test the vaccine for 5 to 10 years before bringing it to market. What are the reports of the adverse reactions? Because I'm hearing all kinds of alarming things about what these vaccines might be doing to people, as unintended consequences of taking them.
So there are 2 answers to this. One is that in the last few months, we are not seeing new reports of something unusual occurring. And the problems are pretty well documented. The other is the number of things that people notice after the vaccine are reported in much higher amounts to the FDA through a system that was voluntary and not a very big system. With this vaccine, those providing the vaccine, us, there are certain things we are required to report that was only a suggestion of what we have to report in the past.
You're referring to the VAERS system, right? Which is
Correct.
the CDC, not
Right.
FDA.
And that's been, well, there's also, for non-vaccines, there's a reportable database. But practitioners tend often not to report adverse outcomes, partly because it's cumbersome. But the vaccine adverse events reportable system is one that they really juiced this up, the reporting requirements and access with mobile phone apps for people receiving vaccines. So they have received huge numbers of reports, including interactive ones where people, you can put in what their symptoms are different days. So they've been trying to find adverse events that might not otherwise be detected. But for example, if someone dies after they get a vaccine, that does not mean cause and effect. And because there are
Doesn't
hundreds-
necessarily,
It,
it could be though.
correct, but especially considering that much of the population, given this, are over 65, as you saw, I think 89% of that population has had it. That is also the age group that is tending to die more often. So the cause and effect is not so clear. But the reports are reports of everything else. You know, if you had a flu shot or something else and you died 2 weeks later, that wouldn't get reported just because it's just.
But life insurance companies are reporting within the age group of 18 to 64 an enormous spike in mortality, and they're trying to figure out why.
So I do not have an answer since I don't have those reports, but
I'll
prior
send it to
to COVID, the life expectancy in the US was decreasing. And part of that is the opioid epidemic, which was the public health issue number one prior to COVID. It's going to be again. Overdose deaths increased locally in the state and nationwide, went up 1.5 times what it was the year before COVID.
This is a 40-fold increase in what the expected mortality rate would be, 40-fold. And I'll also just one more thing is that there's studies coming out about adverse reactions in young people, myocarditis being one of them. And there was a recent study that's come out of Lund University in Sweden that they did a test on, I think it was the Pfizer vaccine in vitro on liver cells, and found that the mRNA portion of that did what's called a reverse transcription and altered the DNA of the cells in that liver that was in vitro. So it has the potential to alter a person's DNA.
So I have a problem reporting that kind of information in a public meeting because I don't know that that's actually, what the basis is for those comments. The myocarditis, inflammation of the heart, or the pericarditis, inflammation around the heart, are problems noted across the age group, especially in people under 65 and adults, where you would not expect difficulties. It also turns out that those are even more common in people who have COVID in those age groups. So and they are seeing a higher number of heart problems across the age groups in people who have COVID, other than myocarditis and pericarditis. They are real issues, but so is COVID. So we have concerns about, these are not the simplest of vaccines to administer, and hopefully better and better ones will keep coming.
All right, so my point then would just simply be that a person who is trying to weigh deciding needs to evaluate the risk versus the, reward in taking one of these vaccines, and that's my point. I'm sure you know where I stand on that, because we've had that conversation. So anyway, thank you very much.
And you had a question too?
I'm going to talk to you about the vaccine after this person.
Thank you.
Any other questions? All right, thanks, Dr. Rudy. I guess we'll just go right into the health administrator report from Gino.
I'll keep it simple and easy. One, it won't go over well with the staff, but I think it's a necessary step. I'm going to have to review the phone reimbursement policy that's in place with the current staff, where we reimburse staff for a portion of their phone bill. I'm going to look up industry practices, see what other healthcare industry organizations do for that type of situation, and try to decide which employees it would require any type of reimbursement if they're using their phones outside and doing any type of field work. If it comes down to just a few people, I probably will have to go with some type of phone contract, a multi-phone contract, and let them carry business phones. And that way, that's one way we can keep costs down on that. So, but I'll look at industry standards and see what practices are done in similarly sized healthcare organizations, and then make a decision based on that. And hopefully we can lower some of those costs.
Gina, so and this is really important, because I brought this up before, and I'd like to make a comment and then also a question that you might have.
Sure.
Is, it is my understanding that somebody from staff for the Board of Health is supposed to be on call for emergency health related issues.
And we do have that phone, and it rotates through the staff.
Okay,
And so there is a 24-hour phone available and it's carried by an individual staff.
I'm gonna tell you, I've called that number and left a message, and it's been more than 24 hours to get a response.
Really? You
So
can give me a day and time on that, please.
it's been a while. It was back probably 6 to 8 months ago.
So prior to my arrival.
Yes, it was prior to your arrival.
Okay.
And I'm not criticizing anybody, but I think that part of the phone reimbursement, the justification that was made to me prior was that, any of those person members can be called in an emergency case. And I support paying the staff's phone bills, but I also think that those all numbers should all be emergencies at any time. If there truly is a county health emergency, if a water main breaks, those are type of things that are emergency calls that the health department is supposed to report to.
Correct. And we do have a phone for that specific with the emergency number that's posted on our website and shared with other county agencies.
Okay.
So we
Well,
have,
I'm really glad to hear you're digging into this.
so yeah, well, it's necessary because as a government agency, frivolous costs need to be eliminated. So I need to look at this and find out at what level we're talking about and get the hard numbers and see if we can't do better. So that's something that we'll look into. The second thing is, and you may not know this, and I have agreement from the staff, we currently pay to have Comcast cable to stream the Weather Channel on the waiting room, the empty waiting room television. And that's costing us, I don't know, somewhere about $130 a month. That will be eliminated completely. We will put a public service announcement loop on our DVD system and use that instead. I think that's an easy savings that can be accomplished. These are all the little things I'm learning as I'm going through the budget and all the monthly payments and all the bills and things, and trying to figure out where there's things that can be possibly gotten under control. And that's certainly one of them. So we'll be eliminating that. And with that savings, then we'll probably be able to take that savings and put it to something much more effective, which would be a high-speed internet system that I'm going to be discussing, having a shared system with the two West Virginia DHHR offices in the corners here, so we can bring in some type of fiber through the state and share that cost. I think we can probably have a more effective internet for them, and also a much better and more effective internet system for us that allows us to do all the things that we're looking to do going forward, which is EMR, electronic medical records, and then also going, which Kayla and I talked about a few weeks ago, moving over to permitting and having all that on, and all, well permitting and sewage, septic permitting and all those things to be also digitized. Have the ability to maybe bring in a team, and we'll talk about that with the county commissioner, with the county commission, to bring in a team that can maybe create some unification between their system and our system, and make it much more efficient, easily accessible through the internet.
I'd be glad to help.
That would be huge.
I've had those talks with Todd at GIS mapping.
Yep. And those are all things that we're considering.
Those are things under the previous administration that were discussed, and I think we were supposed to have had it done by now.
That would be great, but it didn't happen. So here we go. It will happen. And that's it for me.
Any other questions for Gino? All right, thanks, Gino. Moving back to Dr. Rady on the health officer report.
I do not have anything other than the COVID and the grants report.
Okay. All right, moving over to Gillian, environmental report.
Okay, so you have the numbers in front of you. So they had between my two sanitarians, they had a total of 95 inspections and or site visits and 8 plan reviews last month. One of the things that we actually just finished was our new web page. So we do have an intern that helped with that, implementing that new web page for us. So if you look at our homepage and go to permits and inspections, you'll see a much more organized page with a lot of information on it. I did get notice that those retail food safety program grants that we applied for were awarded. Everything that we applied for was awarded, and in fact, they gave us an additional award for the mentorship program grant because they asked us to take on additional mentees. So we were awarded $254,522 in total. One of those grants is a $228,000 grant that's over 3 years, so it's $76,000 per year. And that includes being able to hire a new sanitarian to help with food inspections, which we have advertised for, and we're waiting for a public service announcement on. We've already begun work on the mentorship program grant. Bob organized a meeting with all of the mentees. There's 2 in Ohio and 2 in North Carolina, I believe, and the FDA specialist in both areas. So we've already had our initial meet and greet with them, and we're already starting to work on the standards with them. We also have begun work on the NEARS grant that I told you we were awarded the previous month. We attended the first of 3 webinars for that grant. We also had our Food Safety Advisory Council meeting last month. And it was actually the very beginning of this month, March 1st. So, and as a result of that meeting, we had a couple of the people in the meeting ask us to develop a self-inspection checklist that restaurants can use, just a quick checklist for them to go over on a daily basis with their staff to make sure that they're meeting, that they're eliminating food safety risk factors. And Bob has already developed that checklist, and I have already sent that out to all of our restaurants that I had emails for anyway. And there was also a large recall on infant formula last month. I don't know how many of you saw that, but we, as a result of that recall, we ended up calling or visiting all of our retail food establishments that carry formula and our child cares. So we spent 2 days basically calling everybody, and staff went out and visited in person to make sure everybody had that infant formula off their shelves, as well as announcing it on our Facebook page several times. So I think that's it for my update.
Any questions, Gillian? Okay, thanks, Gillian. Assuming there's no clinical activity report, since we don't have a head nurse, is that correct, Gina?
There's a paper one, but I can't, without the nurse to be able to discuss it intelligently. I just have the raw numbers and the hard numbers for you, that's all.
I can
But introductory,
just look at it
quickly.
briefly. Our usual activities continue with family planning, sexually transmitted diseases. There is a increase in syphilis nationally and in this state and area as well. A fair amount of the increase is thought to be due to intravenous drug use, part of it. And one of the areas of greatest concern is pregnant people, because the child born with syphilis can have deformities. So the recommendation is every pregnant woman be tested 3 different points during the pregnancy to catch anything and treat the person. That's very important. And a fair number of cases that we find out about are because of prenatal testing. It's not huge numbers, but it is a very important issue. It's always been something that local health departments are involved in, because people often do not want to see their private practitioner about this. The general vaccines, we do instruct and dispense naloxone for people in what's under the harm reduction program, and then various reportable diseases are reported to us, and that's and then we have to call and just see that the person has had proper follow-up and that there's not a source that, it's coming from like a restaurant or failed septic or something like that. The vaccination, COVID vaccinations have dropped greatly as they have throughout the nation. We still want to improve that.
Are we administering COVID vaccines to pregnant women?
Yes, and that is a recommendation. Pregnant women do worse with COVID compared to others, and the outcomes in the very beginning, a year ago, there was not sufficient data, but now there is sufficient data to show that there is definitely an improvement in outcomes. So flu and COVID is much more difficult for pregnant women to handle than non-pregnant. That doesn't mean that everyone who's pregnant that gets COVID is going to have a disaster.
Any other questions? Thanks, Dr. Rady. Threat preparedness, Mason?
All right. So first thing is on February the 25th, we wrapped up doing our COVID vaccine clinics over at the Ransom Civic Center. We're only offering COVID vaccine by appointment here at the health department going forward, and we're not really seeing a whole lot of people calling in for that. On February the 15th, I went to a training in Bridgeport, and that was for the hospital incident command system and public information officer training. For those of you who don't know, the incident command system is basically just an organizational structure for how to respond to any type of disaster, man-made, technological, or natural disaster. And going off of that, I also attended a training on the intermediate ICS 300 level class. It's actually a requirement for the threat preparedness grant that all the staff are trained in that class. So I'm going to be working with the LAPC and other members to try to get as many staff members into that class. I know Dr. Reedy was interested. And I went to the one at the VA. There's only one spot available for that one. That is an in-person training class. And it doesn't come around very often. So whenever it does, we're going to try to get as many people as we can into it. So sometime later this spring, I'm going to meet with Chief Berner over at the Jefferson County ESA to try to set up a fire drill. We're also, with that fire drill, we're also going to train the staff on the use of fire hydrants and how to put out fires. We're going to go over our emergency evacuation plan and ensure that it's working for our staff. And then later on, we're going to meet with, our partners in emergency management, fire and police to try to set up an exercise where we run an active shooter training. That's further down the road, probably over the summer or early fall. We're going to try to set that up sometime, and I think that is everything.
I mentioned the CPR training.
Oh yeah, and we got all of our staff members trained on CPR and defibrillation. That was just March the 3rd. No, the 4th.
It was on a Friday, last Friday.
Yeah, it was last Friday. So that was the 4th.
I have a question about a vaccine clinic.
Mhm.
So as you said, that we don't have many people come to do the vaccine. So
Right.
let's say we have one patient calling to ask for a vaccine.
Mhm.
So we're gonna open the one vial, and how many doses? We have 5 doses, 6 doses in the vial, and then that.
Right. So Pfizer, the different ones, depending on the age group, it's either 5 or 10. The Moderna's 20 if you're talking about the boost dose. So it becomes logistically a big problem to give a Moderna to one person and waste 19 doses. Unfortunately, what happens is if no one's using these, the vaccine eventually expires and it's all wasted. So this is a problem that every pharmacy and everyone else, because they aren't like the flu vaccines, individual doses. So COVID, that hasn't yet happened that way. So
Are we paying for those vaccines?
excuse me.
Are we
I'm sorry.
paying for them?
You as a taxpayer.
I'm talking about this
Yeah.
agency.
No,
That
no, they're
federal-
provided completely free and until they're in a person's arm, they are the property of the federal government.
We've also instructed the front desk staff to make sure that they group it. It's obvious that an efficient use of the vaccine is required to be good stewards of the vaccine. So as soon as we set one up, we make sure that we schedule anybody else who would request a similar vaccine to make sure we try to schedule them on that day also. So,
Yeah, we're trying to
We're not
balance
just-
that, and then
Yeah,
if we
of
won't
course.
have availability where we can have several people, then we refer them to a pharmacy that's going to.
That's smart.
So
That's
it's,
what I
it's
was
just
doing.
about getting the vaccine. It doesn't matter who administers it.
Right, we can contact the local pharmacy and ask them, hey. can you do this?
And we will be collaborating with others in the supply how it's delivered to us has changed. And just found out yesterday, we want to order Pfizer, we have to order 300 doses of it. And whether we're going to give 300 before that. So that's something we're going to be probably sharing with some other entities in town so that we're not all ordering 300 and wasting.
Does the health department get anything from the federal government for each administration, for each dose? Does this department get paid?
We do not get paid for administering it separate by the federal government. If we bill the insurance, which is an ongoing thing that will address the earlier questions about, cash flow, is that, so we can get reimbursed for the cost of administration, like certainly the pharmacies are and everyone else. But if someone has no insurance or doesn't have their card, that doesn't slow us down.
And we are billing this.
You're billing.
Yeah, of course. I was notified that the backlog in medical billing is getting very close, and we're starting to bill some of the COVID vaccine. So that was good news, because there was a good bit of that.
Thank you.
No other questions? All right, thanks, Mason. I guess that's the end of Mason's
Yep.
report. Okay, thanks, Mason. All right, Gino, fiscal 23 budget report discussion. I did ask Gino to start putting together next year's budget, given the fact that there was some concern over last year's procedures and timing, which obviously I wasn't on the board at the time, but certainly heard the challenges with sort of what appeared to be some condensed timing in terms of decision making. And so asked Gino to start putting together the preliminary budgets for 23 so that when it comes time with the deadline, which I believe is in June, that we have a fully informed discussion and decision-making process. So Gino?
I had already started that when Karen asked me. We had already begun looking at those numbers and coming up with some type of preliminary budget. Obviously, overwhelmingly, the budget of any employer is going to be personnel costs. So we start with the biggest portion of the budget. And so they're making some assumptions that state revenue is going to be about the same, that will probably be in line with our clinical environmental revenue and those types of things. Where it really starts to become a little bit different is we're hoping through these grants that we're receiving that we're going to be able to employ a few more people in and around an extra sanitarian, possibly a social worker, possibly an epidemiologist on staff. We don't know yet. A lot of these grants are fully funded for personnel costs. So I wanted to make sure that that was reflected in the numbers. That's why you're seeing a significant increase in the annual budget for personnel, but a lot of that will be offset by grants, which we then put in the other, in the income section. So we're probably looking at roughly a $1.2 million personnel budget if we fill all the positions that we're hoping to fill. So, but that's the start. Operating expenditures we overestimated will probably come below what we're estimating here. So we're hoping to run even like we currently are this year and like we did in 2021, at least even, if not a surplus, is what we would try to aim for.
So, Dino, what is the average delay in receiving the grant?
Can be up to 60 days.
Okay. Do you have any calculation? What's 60 days of payroll? With the new budget, with the new people, what's 60 days of payroll?
It's 2 months, so that would be
About 150K.
Okay, so 2 months or 1 month?
Two, 4 pay periods.
Okay.
At current staffing.
No, but with the additional
With
staff.
additional staffing, you're probably talking about 225, somewhere around there, 200.
Well, if your estimate is 1.2 million, then if you 2 months is 1/6 of that, so you're talking about 200,000.
Yeah, exactly. So that's a number to set some type of floor that we shouldn't be below when we have, since we're a lot of these grants do pay out on a quarterly basis, but obviously we're paying out on a bi-weekly basis. Majority of our costs is going out on a
You said quarterly.
Some of them pay quarterly. State aid comes quarterly.
The state pays quarterly.
State pays
So
quarterly
conceivably, some of these grants could be negative cash flow, 400,000.
until they pay out.
Well, we have an operating, but we have
But
how much in savings?
$390 right now.
Typically a grant, once it's billed, pays out in 3 to 4 weeks.
Okay, but from the
When it's
time,
billed,
so how long does it take to build?
usually that month, at the end of the month, it's billed.
All right, so we're 2 to 4 months negative cash flow.
No, more like 1 to 2 months negative cash flow on grants.
Okay.
2 to 3 months on state aid. But that's the numbers, and those, we're going to have to, work with them and fiddle with them, depending on what we think we're going to be able to fill staff-wise. We may not even be able to fill the sanitarian position or this nurse director position going forward.
So we're under 400,000 right now in the bank, so we have to be careful.
Yep. But that'll probably change comfortably within the next 2 to 3 weeks.
Right.
So I wouldn't be surprised to see a very different number at March preliminary numbers and February final numbers.
Okay. Thank
you. And that's just
Gino,
preliminary. I will have hard numbers at least a month before June. I would hope to have them by the April meeting, fairly firm numbers by the April meeting.
We understand this estimate. We're just trying to get everybody.
When do we have to submit it to the state?
For reimbursement, the budget, June.
Before the 1st of June.
No, I believe it's before the 1st of July, or no, it's 30 days, isn't it? 30 days prior to the fiscal year, I believe. Yes. 30 days. So it'll be
It's a little
June.
different for us. So we got
It'll be
labeled
June.
at the end.
It'll be June 1st. Yes, June 1st.
I think it is. I think it has to be approved in May.
Okay, well, it'll be available easily by May. I'd like to have,
By June 1st.
I'd like to have firm numbers by the April meeting. That's all.
Gino,
That's all we
the
started in
legislature,
February.
Gino, I've got a question.
Yes, Karen.
The legislature's passed a pay increase for state employees. I'm assuming the governor's going to be signing it since it was in his budget. Does that apply to our staff?
It does not,
It does not. Why is that?
because as a quasi state, local or state county agency, we're not part of like the state that way. We're actually health department employees. We are covered by the Division of Personnel, but we're not health department. We're health department employees. So. just like the increases in the, or the increases in PEIA, that they, I guess they suspended those, right? The increases? Yes, they suspended, so that doesn't really matter, but yeah,
Right.
it's because of our quasi state county, the rules are a little bit different for us. So that's LHDs. I haven't seen anything through the LHD Association that's saying that these state increases are going to impact us in any way.
It's been requested for many years by local health departments, but
It hasn't happened yet.
Thank you.
Mhm.
Any other questions for Gino on the preliminary 23 budget? Okay, want to go into the environmental grants and current and future. This is per the conversation last month, is to accrue an overview of the various grants. I don't know if Gillian or you or Gina were the ones that put it together. I know it was sent out in our packet, so I'll turn it over to you to go. Actually, let me pause there. I know it was sent out in advance to the board. Does the board want staff to report out on the document, or do you guys want to do you have any questions, or how would you like to go about doing that? Or having this conversation? Any preference?
I mean, I've read the documents, so if we need to discuss it or not.
Okay. So if we don't need a report out, and I don't know that we need staff to go through it since it was delivered to the board ahead of this meeting. Unless anybody has any objection, we'll move on to the next agenda item, which is the termination of the part-time sanitarian. So any objections to moving on to the next line item?
No.
Thank you.
But
All right, I know that. I know.
before we
Oh,
do
sorry,
that,
Elliot.
though, do you mind if I step out of the room for a couple of minutes?
Would you like to take a 5-minute recess for everybody?
That would be good.
All right, let's go ahead and do that, a 5-minute recess.
Thank you.
All right, looks like everybody's back. All right, we'll get started again. Next item is on the termination part.
Wait a second, Nathan's not here.
Oh, sorry. Thank you.
She couldn't.
Unmuted.
Yeah, we're unmuted.
Yep, I can hear you.
Nathan's returned.
Thank you. All right. Next is on the discussion of the termination of the part-time sanitarian. I know when we last left off, when we tabled this conversation, we also had a desire to go into executive session to receive some guidance from the attorney. Is there a motion to go into executive session?
So moved.
I second.
Is there a second?
Go ahead.
All those in favor, say aye.
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 Madam Chair,
Opposed?
I would note for the record that Mr. Custard had previously asked that discussions about him be had in open session. However, I want to provide the board with some advice concerning some potential liability issues. And that's would be the gravamen of going into executive session, not particularly to discuss Mr. Custard's job retention or not retention. So I'm just laying that out for the record.
So if,
So Mr. Custard, I'm assuming that you're maintaining your desire to have the discussion about your employment in open session. Is that correct?
Correct.
Okay. So once I give the board some legal advice about that, then I will, with the chair's permission, reconvene the application.
so we are now in executive session, so.
But the vote.
There's no
first and
vote.
second.
Oh, there wasn't a vote? I thought there was.
There wasn't.
No, I thought you guys said to go into executive session. I thought we had ayes.
Yeah.
No, we had a motion by Elliot and we had a second by Ann Noon, but we have not.
Yeah, we
voted.
did vote.
We did
It's
vote.
over.
Yeah, we did.
I agree with you, Caleb.
Okay, so we had the vote to go into executive session, correct?
I think we should, I make a motion that we re-vote just in case. I'm
I
pretty sure.
thought Nathan cut her off before the.
Yeah, I do too.
I thought, okay, for the second.
Oh.
That's okay. Go ahead.
Does the motion need to be specific of the reason?
Yes. And that needs to come from the chair, and she said to get advice from the attorney.
So we have a motion and do we have a second?
So let's do the motion again. I move to executive session so we can get counsel from Nathan
Second.
Regarding,
regarding legal
Liability
counsel
issues.
for
Liability.
liability issue regarding employee.
Well, just a liability issue is what we're talking
Okay.
about.
okay, so I'm hearing a motion, and if I may reflect what has been said, is that it's a motion to move into executive session to receive legal liability counsel from counsel. Everybody agree with that language?
Well,
Okay,
that's the motion and
yes, is there a second?
Right. I'll second.
All those in favor?
Aye.
All those opposed? Okay, so we're going to go into executive session. I know from a technological standpoint, let's give Mason some time. I don't know if you can put me into a breakout room or if you can temporarily kick the participants off and then have them rejoin. What's the technical movement? You know?
We'll see what we can do here.
Thank you.
And Karen, which,
Everybody got-
Is Mason, are you working on getting the other, oh, I see people coming back in. All right.
Yeah, I'm working on it.
Okay, no, you got it. Thank you.
That's everybody.
And is Mr. Custard present?
Yes.
Yeah.
All right, then we will resume discussion regarding the termination of the part-time sanitarian. Are there any other items that the board would like to discuss regarding this?
Okay, so one of my questions is, in the contract, there's a mention of 1,000 hours. How many hours in this budget fiscal year have been allocated to Mr. Custer? Do you know?
It's on an as-needed basis, but not to exceed 1,000 hours.
Right, and do we know how many?
So far this year?
Yeah.
It's got to be less than 100.
Oh, okay.
Yeah. Mhm.
That would be basically my only question.
Yeah, I had some questions that I proposed to Gino. Did you get those answers about?
Sure. I do have answers to all this.
You have them, if you just want to read the questions I had and provide the answers, that would be wonderful.
So it says, in a special meeting on May 28th, 2021, the budget was approved, which did not allocate any budget for Mr. Custard. Who and how payments been made to Mr. Custard? Well, technically, Mr. Custard was part of the overall personnel budget. He's not mentioned because all of his personnel costs are provided and paid for by grants. So that's the balance between receiving grants and allocating money that's actually coming out of the budget. So his position was completely covered by grants. So it wasn't put in there now.
So, but there was no line item allocation for Mr. Custer's fees. I want to use the word fee because we're not certain of what his employment is yet until we answer the rest of these questions.
Okay.
So there was no line item for it.
Okay.
All right, so who approved payment to him or who wrote the checks to him?
You did.
Not me.
The
I
board
did
felt
not.
that they approved payment to him of passing the budget for fiscal year
Okay, but
22.
where was he named in
Or
the
fiscal year.
budget?
He wasn't named in the
All
budget
right, so
directly.
for clarity, he was not named in the fiscal budget for this year.
Correct, and other employees aren't either.
Okay. All right.
We don't name any of the contact tracers either.
Okay.
He received his pay through the payroll system. And he like any other employee of the health department, he received a W-2 like any other health department employee. And like I said here, he was not mentioned separately due to the fact that he was paid through the grants that he was administering.
His contract is a state standard issue contract. As I saw at the top, it just said West Virginia State Department of Personnel.
It is.
Okay, so it is a standard contract issued to any state.
To any part-time temporary employee for the Division of Personnel.
Okay.
So the next question, which was, please provide us with any invoices, statements, or hours worked by Mr. Custard since he began working with the health department. The goal here is to understand how he gets paid and on what basis. Does he clock in and out and then receive $55 per hour? Does he just tell you how many hours he has worked? Under the previous timekeeping system, Mr. Custard provided the finance technician with his hours worked in the same manner as any other health department employees. Under the current system, Mr. Custard clocks in using the timekeeping system that was implemented in December of 2021, like all other employees. The number of hours he's worked since he He began as provided in the document. Robert Custer pay from 2018 to 2021. It includes the total number of hours worked less than $1,000 or 1,000 hours annually and his most recent pay rate. Next question was, please provide us a copy of all grants that Mr. Custer has secured for the Health Department, along with copies of the submissions for these grants, including but not limited to letters and online submission forms. The details of the grants are in the document JCHD Grant History 2018 to present. Next question was, please provide us a copy of any policies that Mr. Custer has created for staff and or public at Health Department in the last 12 months. Mr. Custer has not created any policies for staff in the past 12 months. Under Gilliam Beach, with the consultation of Mr. Custer, 10 new food safety policies have been established. And you wanted a confidential copy of his last 4 paychecks or payments, and I was advised not to provide that by the chairperson of the Board of Health.
Okay, so was there a period of time that Mr. Custer received payment from the health department and he was not an employee, he was working as just directly as a consultant?
I leave that for Bob to answer.
Yes, from April 20-something, 20th roughly to May 10th roughly of 2018.
Did you have a West Virginia business license at that time?
No, I am,
Did it exceed more than $600?
excuse me?
During that time, did you have a West Virginia business license and the payment exceed $600?
The payment exceeded $600, so I'm a sole proprietor LLC, where my LLC does not post a separate tax return, and so I am treated as a separate individual for tax purposes, and am not required to have a business license, is my understanding.
So you say you consult, make sure I understand, and I'm asking in a very open, calm way, is that you invoiced the health department during that period of time? Is that correct?
One invoice, correct?
Okay. As a business,
Correct.
and you believe that you didn't have to register your business in the state of West Virginia?
Because I'm a sole proprietor LLC, correct?
Okay, so would, in your theory, would a sole proprietor LLC that sold sandwiches, would they be regulated by the health department?
They would be regulated whether they were a sole proprietor LLC or an individual. Either way, they would be required to have a food permit.
Okay. So you're saying that this state agency regulates sole proprietor LLCs, but the business licensing doesn't. And is that the theory that you're following?
Well, I'm not sure I'm following your question, but my understanding is that I was not required to have a business license because I am a sole proprietor LLC. And this went on for 3 weeks, which has been standard practice for this health department when they are in the process of hiring an employee to hire someone as an independent contractor until the next pay period begins and they can be put on payroll through the Department of Personnel System.
Nathan, your experience in the county, do we issue a payment? Does the county offices issue payment to any private entity that doesn't have a business license?
It's outside of my scope of knowledge. My only interest, I suppose, as a prosecutor would be, is that a crime? And it seems to me as though he was onboarding here. And as a practical matter, I don't imagine that you could find a prosecutor anywhere that would call that a crime. And second, even if it was a 2018, it would be a misdemeanor. The misdemeanor statute of limitations is here, so it would not be prosecutable now, even if it were.
And it was common practice because when I was hired and when a couple of our sanitarians were hired, the past administrator basically hired me as a contractor for the first 2 weeks until the state paperwork went through because they wanted me to start right away. So I was hired May 1st for my first 2 weeks of employment. I was not in the state system. I wasn't in the state system until May 14th. They did it with a couple sanitarians. They've done it with a lot of other employees that they hired, where it takes a while for the state paperwork to process, so they hire them as a contractor. Before that was previous practices here, common practice. Nobody was notified that we would have to have a business license in order to work. We were just issued 1099s for the first couple weeks of our employment. And that's happened to me. It happened to several other employees in this office. It is no longer a practice here, but that was common practice in this office for years.
So, and then the majority of your consulting fees are for grants, or does that parlay into other things? Do you do other things and functions for the health department, and do you bill for that?
When I first came here, if you recall, there were no full-time environmental health professionals.
I'm just talking about like really current.
Really current.
Yeah.
98% of my work is with grants. On a rare occasion, I will be asked about some non-grant related activity, which staff may not have the experience and they ask for a second.
So what you're, my understanding that you've been working on a really large like FDA grant that has to do with food safety, and you have a committee that works on that.
Yes,
What's the committee's advisement on restaurant inspections?
I don't follow your question, sir.
Well, I don't know how many, I mean, are we doing regular septic or restaurant inspections?
Yes, we are, but not as many as we'd like to because we're very short staffed.
Okay, so in last month we did 17 inspections, I think that it said.
For the restaurant, they also were doing childcare inspections, which is under general and other. So I don't have that number right now.
Okay, and how many food establishments are there? Is there 300?
There's 400.
400. Okay.
So we have 400 establishments, and right now we only have 2 sanitarians for inspecting those, and they also tasked with doing childcare, mobile home parks, swimming pools, and the septic program.
So we have 3 sanitarians, so concluding.
The third sanitarian cannot do any field work on our own.
Okay, so when you say 2, that's like including you also?
No, 3 would include me if
Okay.
I can ever get out of the office.
Okay.
But a lot of my time has been spent answering board inquiries, along with a lot of other things that I do as a supervisor.
Okay. Thank you for addressing these questions.
When it comes to mention 10 policies that Mr. Custer contributed to implementing and creating, what would that entail?
So those are policies that we need to have in place in order to meet the program standards for the grants that we are working on. So with some of the past standards we have met, Mr. Custer has written policies that I have approved. So he writes the policy, I review the policy, I make any changes to the policy that I see fit, and then I approve the policy. So there are policies that basically have to do with our staff and how they're expected to do the food inspection.
Okay. So those, all right, so those, all 10 of those were specific to food inspection?
Yeah. Over the past year, yeah.
And those food inspections, they're were exclusively at restaurants?
They're all of our food establishments. So it can also be grocery stores
Okay.
and other retail stores. So.
Okay, can you give me an example of one policy?
So we have basic policies that basically just discuss the equipment that inspectors are inspected to have with them, the type of form that they're using to do their inspections, just basic policies about how to do your job and basically to become standardized. We also have policies in place about the training that's required for them to become standardized. We have.
So it doesn't change the criteria used for the inspection, just the method of which and how that the data is collected that's already been established. And who establishes that? Is that
No, there were no policies in place in this department before we came on. There were no policies in place for restaurant inspections or for any kind of standardized way of doing inspections.
So who wrote those policies?
Bob and I.
So here's the question I would have. So there's a regional and then there's a state sanitarian that you can rely on for additional information. Is that correct?
There's not we don't have a district sanitarian.
Richard
because
Wheeler's no longer.
he's been retired for years. He hasn't done anything as far as this position has been vacant for about the entire time I've been here. He was actually retired when I started. So that's almost 4 years now.
Because, but there's a state level, Rick Hirsch's, that if you have a question about
That's
how to do an inspection. And,
that's separate.
okay, so is there also a similar position?
Yeah,
For restaurants?
Jennifer Hudson is in charge of the food program, so we do reach out to her if we have questions, but it's not about how to do our inspections because every county is different. There's no standardized process in the state.
Okay, so the question I would have would be, why in Jefferson County is there a need for a consultant to do that, whereas in all other counties, I'm not done my question. They appeal to the state level and how they run their procedures and they get their guidance from that.
That's not true because there is no procedures for these things in the state, or people would just get it directly from the state. The state is also doing the pre-program standards and has met several of the program standards themselves, and they're encouraging all local health departments to work on the program standards in their departments. And the state is hiring people to help them manage their grants as well, and so are some of the other counties. These are large grants that require more than just regular staff to run.
So how does like Berkeley County, for instance, they get grants, all right, and then they have their programs and they have their initiatives. Who sets these policies and procedures and gives us guidance? If it doesn't come from the state level, does it come from the administrator and head of the environmental department?
That's typically the way it happens with local departments.
So that's
local
typical.
level.
That's typical that the administrator and other management positions such as yours would administer and create those policies in other counties.
Like I said, we are trying to meet the retail food program standards like the state wants us to. So we have been working on that program for the past 3 years, and we're trying to continue our work on that program to improve our program. In order to do that, we have large grants that we need help managing, and that is what his role has been, to help manage these grants.
Last week I called Ms. Harden over the supervisor of sanitarian over Berkeley County, and she does not have a consultant.
That's because they're not working on the program standards. They are not working on these grants. So it's not much of a comparison, and the state is encouraging counties to do this.
Are you aware of any other county in the state that has a consultant that does this?
I can speak for the counties themselves,
Are you aware?
but
of
I know the state is hiring people to help with their grants.
Are you aware of any other county having a consultant?
I don't know if any other county was able to get a grant as big as ours to manage, and I'm not aware. I told you that. I'm not aware. I don't have that knowledge.
So you're not aware, okay.
Well, actually, I could tell you, I just fulfilled a contract for Monongalia County related to the program standards.
So the program standards are dictated by the grant.
Yes.
Okay.
The grant itself is giving us money to help meet the program standards, and in order to meet those standards, we have certain things that we're supposed to be working on.
And that those standards are promulgated by the grant issuer, which is what? Who's the grant issuer in that case?
What do you? I'm not sure what.
So the grant you received was for
Let
FDA.
me ask you a question, all right? I mean, the money comes from somewhere.
Yes, the money is coming from NEHA. They're the ones who are administering this grant.
And what does that stand for?
National Environmental Health Association.
Okay. And is that a federal agency or is that a?
No, it's an
It's an NGO?
association. It's an association that they set the basically certification and some standards for our profession, environmental health professionals.
Because some organizations that set standards like NIST, for example, that's a federal agency. agency, but this is not.
They're not a federal agency.
Okay. And the grant, they have people who contribute or companies that contribute to.
I believe they got federal funding.
Okay, so that's, I'm trying to
So,
find out where the money's.
Those funding ultimately comes from FDA
right.
and the 9 national voluntary program standards
Okay.
come from FDA. They deal with everything from your regulatory basis, your staff training, risk-based inspections, foodborne
'Cause-
illness investigation.
Yeah, it would seem to me though, that if this organization, the Department of Health, is promulgating standards that are being set through this grant process, that they probably should be under review, because this is major policy stuff by this board, because the board's never seen this.
Explain to them the food safety code that comes down with, and the administrating part of that, with which code are we now operating under? And obviously the goal is to get to the next level.
We currently operate under the 2013 FDA USDA food code,
Which is done by FDA.
which is done by
But
FDA.
approved by the state.
FDA has actually come out with a 2017 code. It was supposed to come out with a 2021 code last year, but COVID delayed that. I expect we'll come out with 22 code this year. I expect that code will be adopted by the state in 23. But those changes happen every 4 years in consultation with industry through the Conference of Food Protection. As part of that, they have developed these 9 program standards for health departments across the country that can certify that they in fact are meeting those 9 program standards and have a first-rate food program, basically. The FDA is providing funding to encourage people to meet those standards because they realize it will decrease the number of foodborne illness cases nationwide. And they've made some pretty generous grants. We've been fortunate. We're only one of about 2 or 3 health departments in the whole state that have gotten these grants, and we've done much better than others. We've received something north of $300,000 in grants in the last several years, including the $200 and some thousand grant we just received. We expect to receive over $100,000 in grant funding in each of it this year, next year, and the following year. And these are calendar year grants. To continue to work on these food safety initiatives, they actually provided us money to hire another sanitarian, which will help us not only catch up with restaurant inspections, but will help us do better on the on-site side because with a larger staff, we can be more responsive.
So these policies that have been created and issued by the Department of Health, Jefferson County, that new website that you sent a link to is pretty nice. Are those, is there going to be a spot on that website where somebody can come and take a look at what standards they're supposed to live up to?
The standards are for us, they're not for the industry. So it's standards for our department to meet, just like it also helps for health departments that want to become accredited, which we are not, and we haven't started working on the accreditation process, but if we were to, they would expect our food program to meet minimal standards. And this food program, before we started working on this, had no standards. There were no policies and procedures in place for the staff. And we are just creating those basic policies and procedures that staff need to follow while they're doing the inspections in the course of their work and also for their training.
So, all right, I'm going to have to stop by then and take this conversation offline so that I understand all this process because, you know, as a member of this board, I'd like to know how all of these things are done so that, you know, I have some sort of reasonable context on which to, you know, think about these things. So this is a whole new
It's just minimal standards that we're creating for our staff to meet. It's not policies for our businesses to meet. So
Well, yes, your staff are carrying out policies on which they are doing inspections. And so those criteria are even, you know,
Are established by the food code.
right, okay, so that's,
They are established by the food code, which is 2013, the one that is adopted.
the FDA.
So they
Right.
literally have a form that they use that applies those codes to go down when they do their checklist for an inspection.
I have a question. How long does it take for you to write a procedure at my work when we have a new
that is
task?
not the
It takes
only
me
thing,
3 days to write a procedure.
but that's not the only thing that we're doing is writing procedures. And maybe it does take 3 days to write one, but we had to write, I'm not even sure how many policies were included in meeting the standards, but there is a great many policies that they expect us to have in place. So but that is only part of what this grant work entails. A lot of it entails my time spent on the grant. A lot of it will be conducting standardized inspections with my staff. So myself becoming standardized and then standardizing all the staff to make sure that we are doing inspections uniformly. So we're all looking at the same things, the same risk factors when we go and do our inspections. So it's making a uniform inspection system in our department.
Right, like my organization, we deal with human life. And we have thousands and thousands of specimens coming through our lab, and we have one standard procedure, and that take us, like when we do an inspection again, it take us probably 1 month to go through the whole book, and we comply with the state and the federal, the CAP inspection with the college, American pathologist. We comply with so many agencies, and it take us 1 month to go through them. It's mind-boggling to me to hear that it's taking years and years to do that, like years.
Well,
There's 9 standards that have to be met, and in order to meet these standards, it does take a lot of time to meet them. Some of them we may never meet. The minimum staffing for standard 8, we will likely never meet because based on the number of establishments that we have in this county and the minimum number of inspections that we should be doing on each establishment, we need 4 staff that are full-time staff dedicated to just food inspections. And we will never have that much staff to meet that one standard. So the other standards we can meet based on regulations and policies and training and standardizing staff. Those are the things that we're trying to do to have this uniform inspection program. And the state's encouraging all departments to do this as well. Plus,
So-
it's providing us with an additional staff member.
Right,
So-
but you don't need a consultant to walk you through the day-to-day basic.
Now, I have a really important question. So you said you wrote a grant for Magnolia. What county, what other county in the state?
Monongalia.
Monongalia? How did they compensate you?
They wrote me a check.
On what basis? On what hourly basis?
It was a fee, a fixed fee for providing a specific service.
What was the fixed fee?
Uh,
The amount?
I don't think I have a responsibility to discuss my personal business with you. It doesn't affect this board.
Understood. Yeah, you don't have to answer,
So
sir. Do you have?
go back and explain to them what these safety standards are, the food safety standards that we're trying to meet.
I wasn't
Well,
quite, I wasn't done with my
yeah.
questions. I want to know if Mr. Custard works in any other industry writing grants that would conflict him for writing grants with us. Do you have any other engagements with the private sector that would prohibit you from writing any grants for the Board of Health?
I have a contract with the National Environmental Health Association that I would need to be careful not to create a conflict of interest. And I have a specific conflict of interest agreement with them so that there would not be a case where I would for example, be scoring a grant application that Gillian had written. Because I also review grants at the national level.
All right, so let me make sure I understand. You have an engagement with another agency that you've entered into an agreement that prohibits you from working, reviewing, or consulting on certain grants for this board. Is that correct?
I think you have added words to what I said. I could not review a grant that had been written by Gillian if I'm working and being paid under that grant.
Okay, so but could you write that grant? Could you write that grant for both of these agencies that you've engaged?
No,
Okay,
and
so
I have not. Gillian wrote the grant.
so what you're saying is that Gillian's more capable of receiving these grants because you actually can't engage in some of them.
No, I wrote the grants because he can't write the grants. And he can't review the grants that I've written because we have him included in management of our grants. It was submitted with the grant documentation when I wrote the grants and submitted them.
Right, so the basis of it is that you're prohibited from being involved in some capacities with some of our grants because of your other engagements. Is that yes or no?
Yes.
So we can go on all day talking about the standards themselves and this whole process. And it's clear, I think, that we all have a learning curve because there's a whole area of oversight that I'm sure most of this board wasn't even aware of. So
I have done past presentations before you were a member of the board.
okay, so I guess I'm the new kid on the block, and so maybe it's my learning curve. All right. So all that said, the issue at hand is Mr. Custard's employment contract, and I think I would like to make a motion because it's going to take some time actually to get up to speed as to all the aspects of this issue. So my motion would be to terminate Mr. Custard's agreement, because in the agreement, it says we can terminate at any time as of the end of the budget year, which would be June 30th. That would, and if we can study this issue more over time, if we decide we want to re-engage Mr. Custard, and if he's amenable to that, at that time, we can. But I think what would make this board more comfortable at this moment is that we have an end date to this contract, and that would be June 30th, which gives everybody plenty of time to get up to speed on all of these issues, and then figure out, because we also have this budgeting process, so we can then decide whether we want to make room for Mr. Custard in next year's budget. So I would like to make that motion right now.
Can you make it more succinct?
Yeah, that we terminate Mr. Custard's contract as of June 30th of 2022.
Is there a second?
Let me hear the motion that we terminate Mr. Custard's
Contract as of June 30th, 2022.
Just let it sunset with the
Yeah,
budget.
right. Right, exactly. It sunsets with the budget, and then we can review over the next several months as we do the budgeting process as to whether or not it's a good fit for us to go forward with Mr. Custard in the next fiscal year. But I think we should sunset the contract as of June 30th. That's a great way to put it. Thank you.
So to reiterate, the motion is to terminate the contract with Mr. Custard as of the end of the current fiscal year.
Yes.
Yeah.
Correct.
Is there a second? Hearing no second, the motion appears to fail.
I'll make another motion. I move that we terminate Mr. Custard effective June 30th. And that during the period of time from now until June 30th, Mr. Custard can only work on procuring, fulfilling grants that he's not in conflict of. And on June 30th, there is going to be no board action to reinstate Mr. Custard.
I'm not sure that we can tie a future board action.
Right. Yeah. Okay.
No, you can't.
We could all be hit by a bus tomorrow and there's a new board.
I'll remove that.
So then his motion is essentially the same as mine. Will you second mine?
Well, mine is kind of boxing of what we're
Oh,
paying,
I see.
what we're paying for.
Okay, all right.
Okay, so let me just reiterate it, David, make sure I hear, we have this correct. The motion is to terminate the contract with Mr. Custard as of June 30th and limit his work on existing procuring and filling grants that are not in conflict with this Board of Health. Is that succinct enough to cover what you're looking for?
Right, and we're not going to do, that's right. He's not, just for clarity, the board is not going to use taxpayer dollars for any other services that Mr. Custard may be able to provide.
Sorry, I'm just writing this down. I just want to make sure it's absolutely clear for the record.
I don't think that needs to be in the motion, but that's when you're limiting him to what he's.
That's right.
So I think then the motion is that his contract sunsets at the end of the fiscal year and that he's the focus and only, he's directed only to do grant writing, grants that don't conflict with the other agencies. Is that right?
Right, so that goes back to my original recap here. So as of June, the motion is as of June, we will terminate Mr. Custard as of June 30th, sunsetting with the current budget year, and his work will be limited to procuring and fulfilling grants that are not in conflict. Excuse me, in fulfilling grants that are not in conflict of this Board of Health.
I'll second that motion.
All those in favor say aye.
Aye.
All those
No.
opposed?
No,
So reflect the record. We've got 4 voting yes, 1 voting no. The motion passes. All right, we're going to move on. So we do still need to revisit the meeting minutes from,
I just wanted clarification on exactly what that means, because you can't do anything as a conflict in anyway. That'd be neglect or malfeasance.
Well, then it's just a clarification.
And he provided a conflict of interest statement to me as well, the one that he had and had approved from the home. So I know exactly what his conflicts are, what he can and cannot do, so does he, and he never does anything he cannot do.
Just kind of.
thanks,
Yeah.
William.
Let me just, so I'm clear that this would mean he can't do a site inspection unless it's part of the grant as far as a training of, going over procedures and things like that as part that's related to the grant. But issuing permits on behalf of his health department, he would not be doing that.
It's my understanding, and I'm happy to go on public record. It's my understanding, listening to the staff, listening to Mr. Custard, that his primary focus has been to write and procure these grants. That he has some ongoing work with probably the largest grant he's received. It runs through, somebody commented sometime into May. And that his main purpose, my understanding, is to clean up and work through these grants through the end of the fiscal year. And that we're not, with this past motion, we're not spending any of the taxpayer dollars on anything other than that. Okay. That's my understanding.
All right. So to your point, Karen, in terms of the leftover businesses, I'd like to make
Right.
a motion to approve the minutes as written.
I
Is there a
second that.
second,
Thank you. All those in favor of approving the, what month are we in? The February minutes, say aye.
Aye.
Those opposed? All right, the motion passes. Our next meeting will be scheduled for April 8th at 9 o'clock. Do we have a motion to adjourn?
I Move to adjourn the meeting.
Do we have a second for adjournment?
Second.
All right, all those in favor say aye.
Aye.
Those opposed, motion passes. Everybody.
Thank you.
Thank you.
Everyone, another meeting I have to run to.
April 8th, is that what you said?